Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started.
Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. Today, I want to dive into talking about what to do or how to manage injuries if we get injured while we are away at a summer intensive. So we're a few weeks into the summer. Hopefully everybody is off enjoying summer intensives if that's something you're participating in this summer. But what do we do if we are managing an injury while we are at a summer intensive? So in an environment that we're maybe not as familiar with and in a structure that is maybe a little bit different where you're there for a week or 3 weeks or whatever the case may be. So first of all, I just want to preface this by saying, obviously nobody wants to get injured at a summer intensive. There are really exciting opportunities to go and get to experience a new setting, work with different teachers, meet new friends, all of those fun, exciting things. So nobody wants to get injured, but the reality is we know that injuries happen. And so there are going to be a percentage of dancers who are managing or dealing with an injury while they are at a summer intensive program. And that might be dancers who are coming in and might be dealing with an injury that is pre-existing, and we're going to talk about that a little bit, or it might be an injury that happens while we are away at a summer intensive. So I just want to talk a little bit about things that we can do to help manage those injuries while we are at a summer intensive and hopefully still have a good experience, because although the primary purpose of a summer intensive is to go and is to dance, obviously, and enjoy the dance experience and learn and grow as a dancer, there's so many other benefits of a summer intensive for a lot of dancers, especially younger dancers. It's often maybe the first time they're away from home, especially if you haven't gone to a sleepover camp or things like that before. It's maybe the first time you're having more independence away from your family, having to manage things like doing laundry for yourself or things like that. It's such a great opportunity to meet friends from all over different cities, oftentimes different countries, and there's usually lots of other activities that are associated with a summer intensive. So different social events, whether that's evening activities, movie nights, going off on different field trips on days off or things like that. So there's so many aspects of summer intensives that we can continue to enjoy even if we are dealing with an injury, that we want to make sure we can try and make the most out of this experience, even if maybe the dancing part of it is not going exactly as you had hoped or is not going exactly to plan. So, like I said, there's sort of two different categories, and we maybe treat them a little bit differently in terms of dealing with injuries or managing injuries at a summer intensive. So sometimes we have dancers who are going into a summer intensive program and they're already dealing with an injury. So we all know that auditions or applications for summer intensives are usually happen way earlier in the year. It actually seems like it's happening earlier and earlier every year. So maybe you've decided where you're going for that summer program months and months and months ago, but then you've continued on through the dance season, and whether that's shows or competitions or exams or whatever, and maybe you've had an injury develop. So what do we do in that instance? Well, first of all, we do want to consider the extent of the injury and the seriousness of the injury, and whether participating in that summer intensive is still the best option for you as a dancer. So in some cases, it might be fine if you're in the later stages of recovery and you've been doing some rehab and it's not a super major injury or a really serious injury. You might actually be totally fine still participating in a summer intensive. But in other cases, it may be that what you are able to do in terms of your limitations or modifications that you have to make might actually mean that participating in that summer intensive is maybe actually not the best plan for you that particular summer or this particular summer. So maybe it requires some evaluation of kind of deciding whether actually going to the summer intensive is the best option, or maybe we stay home and focus on rehabilitation and fully healing the injury and all of those sorts of things. So that's definitely conversations that dancers need to be having with their family, with their maybe teachers from their home studio, certainly with their healthcare team. So if they're seeing, if you're seeing your doctor, chiro, or physio, or whoever it is, those are conversations that you may need to have in order to determine, okay, is this the best option at this point in time? And I know it's super disappointing to miss out on things that you've worked really hard for in terms of getting to audition and getting accepted into the programs and all of that. But sometimes it is not the best decision to go and participate. And so sometimes we do have to make hard decisions in terms of really prioritizing our long-term health and our wellness. So first thing, make sure that you're evaluating whether participating is actually really in your best interest at that point in time. The next thing that's really, really important is to be upfront with the staff at the summer intensive with what you're dealing with going into the summer intensive. So a lot of dancers, I think, try not to disclose if they have been, rehabbing from an injury or dealing with pain or an injury or something like that, because they don't want to be treated differently. And I absolutely understand that for sure. But it's so important that we have open and honest communication with the teachers that we're going to be working with throughout the summer, however long that duration is, whether that's a week or whether that's 3 weeks or 5 weeks or whatever the summer intensive duration is. We really, really need to have open and honest communication. So if there are limitations of things that you are not yet able to do or things that you are modifying, and that could be anything. That might be, okay, I can only do a limited amount of jumping, or I'm not ready to do point work yet, or whatever that is, the teachers and the staff at the summer intensive need to know that, because if they don't know that, they are going to push you and challenge you the same way they would any other dancer, and they may be putting you at risk for further injury, and we definitely don't want that. So especially, like I said, if you're in the later stages of rehab, oftentimes it's fine for dancers to go and participate at a summer intensive as long as they're following some guidelines. And especially this is true. I have a lot of dancers who maybe are going off to intensives that are anywhere between 3 and 5 weeks long. So they're quite long. And maybe for the first week or 10 days, they might still be having some modifications from an injury that they're recovering from. But by the end of that summer intensive, we expect and know that they will be able to fully participate. So it's still absolutely worthwhile for them to go. But those teachers need to know that they're still modifying certain elements of what they're doing. So making sure that you communicate that to the staff at the summer intensive is really, really, really important. And best case scenario is actually to have your healthcare provider, so your physio or whoever it is, actually, in some cases, we'll communicate with the summer intensives directly, but oftentimes we aren't necessarily able to do that, but we'll put together a letter or a form that has those limitations. So it's not necessarily up to you to relay that information. I will send dancers to a summer intensive with a form that, just says, hey, look, they've been recovering from this injury. They're totally fine to participate, but these are the limitations that they're still dealing with. And, I have a form that has check boxes and stuff on it. It's actually quite easy to fill out. And sort of to say, these are the limitations, this is how long we expect them to last for, other than that, they're totally fine to participate, but if you can just help facilitate the end of their recovery or their rehab, that's great. And then obviously I provide my contact information, and if they want to communicate directly with me, then that is an option. So at the minimum, like I said, we want to be communicating that information to the teachers in the dance classes. Every summer intensive is going to have a different procedure or kind of policies and procedures in place in terms of who that information gets shared with. In some cases, it might get shared with, some sort of a director position, and then they will disseminate the information down to all of the teachers. In some cases, you could just tell the teacher directly. In a lot of cases, that information gets shared with the medical team if they have healthcare providers or a medical team that they're working with. But we really, really, really want to ensure that dancers are communicating any limitations that they have, or potentially it's the parent who's communicating those limitations. And then the final thing for dancers going into a summer intensive who are maybe dealing with an injury or have been dealing with an injury is just to make sure that you're listening to your body and you're not pushing beyond your limitations. And so I know in a new environment, every dancer wants to really like impress the teachers. You want to put your best foot forward and really make an impression and dance as well as you can. And I understand that, but we need to make sure that we are doing that within the limitations that you have. And so we don't want to risk further aggravating the injury or irritating things more by pushing beyond what your body is capable and meant to be doing in that moment. So it's really important to continue to listen to your body. And I know that sometimes it's hard when you're in a new environment because it's exciting and, you might be doing different styles of dance and different choreography and different challenges that you're maybe not as used to. So it's extra important to really listen to your body and try and make sure that you are following whatever limitations have been put in place and not pushing your body beyond where it's currently at in terms of rehab so that you can continue to recover. And then hopefully, like I said, by the end of the intensive, you'll be good to go and things will be fine and you'll be able to fully participate. So that's just a few ideas of things that are really important if you're going into a summer intensive managing a bit of kind of a niggling injury that just hasn't fully recovered yet before that summer intensive starts. On the flip side, we have dancers who will unfortunately get injured while they are at a summer intensive. And again, we try and hope, or maybe hope's not the right word, but we try and minimize the amount of injuries that dancers are dealing with. But we know that we cannot prevent 100% of injuries. So there are still injuries that are going to happen when dancers are away at a summer intensive. So what do we do to manage those injuries while we are away in that type of situation? The first and very, very, very most important thing to do if we are dealing with an injury or pain, so even just persistent pain, this isn't even like an injury where you've, sprained your ankle or something really like acute traumatic has happened, because in that case, the teachers are going to know about it. They were likely there when it happened. But the most important thing when you are dealing with an injury at a summer intensive is to make sure that you tell someone about it. And again, it's going to depend a little bit on the setup of the summer intensive and even your comfort level with different teachers, who it is that you tell that you are having pain or that you've injured yourself or that sort of thing. So maybe it's going to be one of your teachers from one of your classes. Maybe there's kind of a main teacher that you have a lot of your classes with, and then other teachers that you maybe only see periodically. They're more like guest teachers, so maybe it's that main teacher that you tell. Maybe there's a director or somebody who you're familiar with, and that's the person that you're going to tell. And in some cases, it might even be like a resident advisor, the people in the dorms and that type of thing. So depending on what the setup is, if you're living in dormitory accommodation and stuff, maybe that is the easiest person for you to tell. And then they will be the person who directs you where to go and how to deal with this. But the most important thing is to make sure that you tell someone about this injury. So many dancers try and kind of just deal with it on their own, or I don't even want to say hide it, because I don't think dancers are necessarily super intentionally not telling people, although maybe in some instances they are. But I think dancers just don't want to make a big deal about it. And so oftentimes they just kind of struggle silently and sort of push through the pain and sort of potentially exacerbate the injury and make it worse by continuing to dance through it. So it's really, really, really important that we tell someone. And then whoever you're telling about the injury will likely know what the protocol is at that summer intensive in terms of who you go to next, or who they tell, or how information gets relayed to the people who need to know about it. Because the next thing we want to do is learn how you can access healthcare through the summer intensive. So most summer intensive programs, and certainly not all of them, but a lot of them do have some connection to healthcare providers. And in some instances, there's actually people on site that dancers can see. And so you can book appointments with, or there's a way to access healthcare providers on site. In some cases, it's off-site healthcare providers who might be providing the healthcare services, but that summer intensive might have a connection to them. And so we want to find out how you can access those healthcare services so that you can go and get your injury assessed and learn, potentially like get a diagnosis, how severe it is, can you keep dancing, what are the modifications you need to like implement, all of that type of thing. But you need to know how you can access healthcare services, and the summer intensive staff is who is going to be able to tell you what the sort of policy or procedure for that is. In an instance where it's maybe not possible to access on-site healthcare services, or maybe even in an instance where you can access on-site healthcare services, but if you have a healthcare provider at home who you're really familiar with, either, you have a trusted relationship with them and they know your injury history and your body and all of that type of stuff, you might actually opt to do like a virtual appointment with a healthcare provider that you're already familiar with rather than seeing somebody on site. And I certainly have dancers who I do virtual appointments with while they are away at summer intensives. It's actually quite common. And sometimes it's a scheduling thing. Like it's just easier for them to do a virtual appointment outside of their dance hours. Sometimes they can't get in with the staff on site. And sometimes they're just more comfortable with somebody that they know and already have an established relationship with. So that is absolutely a viable option as well. If you do go down that route, then again, there needs to be communication between your healthcare provider and the summer intensive staff. And so depending on what the nature of the injury is or what the modifications are, that communication might happen directly between the healthcare provider and the summer intensive staff if everybody has permission to communicate with each other, or it might be as simple as you, as the dancer, or potentially your parent, relaying that information to the staff. So it doesn't matter too much how that's happening as long as this information is being shared so everybody's on the same page. So again, we want to know what is the severity of the injury, what is the diagnosis, what are the modifications or limitations for that dancer, and then we want to make sure that the staff at the summer intensive is aware of all of that. Another thing in terms of managing injuries at a summer intensive is you want to make sure that you remember peace and love. And if you have no idea what I'm talking about, I want you to go back and listen to episode 16 of the podcast, all about dancer first aid or dance injury first aid. And really, it's just injury first aid in general, but we're going to say dance injury first aid. So peace and love is the acronym that we use to figure out what steps we need to take when we're thinking about first aid for injuries. And so in the past, we used to use that acronym of RICE, which was like what did it stand for? Rest, ice, compression, elevation. We've replaced that acronym with peace and love. And so, like I said, if you have no idea what I'm talking about, go back, listen to episode 16, because you want to make sure that you are implementing the peace and love part of injury first aid, whether you have or have not seen a healthcare professional yet. You can follow those steps on your own to some degree. It's easier to follow them if you've had an accurate diagnosis of your injury, but even without having a full diagnosis, you can implement peace and love. So make sure that you're familiar with that acronym. If you're not, go back, listen to episode 16. I also have done a blog post about it and have some Instagram posts and stuff, so you can look those up as well. But making sure that you know the things that you should be doing as a dancer for first aid if you do have an injury that you're dealing with, especially if it's sort of more of like a minor, sort of like you've just like been getting pain in an area and you're like, I don't know if this is even really like an injury. You might find that there's some things that you can do yourself to help deal with that pain in order to allow you to continue participating in the summer intensive. And then finally, similar to what we were talking about when we were talking about if you came into a summer intensive with an injury, even if you are injured at a summer intensive, we want to listen to our body. And so again, I think it's hard in a new environment and in a new setting for dancers to admit, maybe to themselves, but also to people that they're not as comfortable and not as familiar with, that there's something going on and that maybe they need to pull back or modify or, deal with whatever it is that's happening in their body. So it's really important that you listen to your body and modify when necessary, because oftentimes we know the majority of dance injuries are not necessarily severe dance injuries. So usually it is possible for dancers to continue participating at some level and can usually participate in, a decent amount of class. There just might need to be some modifications that are made, or they might have certain limitations on things that you cannot do during class. And often if we figure out what those limitations and modifications are, then dancers can still really successfully participate in the summer intensive. But if you ignore what's going on in your body and keep pushing and keep pushing and keep pushing, oftentimes we make the injury worse and worse and worse, and it can get to the point where it's actually then not possible for the dancer to continue dancing. So I always say it's far better to modify things for a little short period of time if you need to, rather than pushing through, ignoring the signals your body's giving you, and then not being able to dance at all. So those are just some ideas of some things that can help you manage injuries if you do happen to either be going into a summer intensive with an injury already or happen to be injured at a summer intensive. The final thing I will just sort of leave you with, or the final thought that I will leave you with before I wrap things up today, is that I want dancers to also remember when you're dealing with an injury or if there's something going on in your body, I also want you to remember what your priorities are for the dance season. And so oftentimes dancers are participating in these summer intensives for a week, a couple of weeks, whatever it is, as an extra opportunity. And that's super fun and it's super exciting. But usually your main priority is going to be with your home studio, and it's going to be the upcoming season. And whether that's the upcoming competition season or, maybe it's like Nutcracker coming up at Christmas or whatever it is, that is usually dancers' main priority is the upcoming season. So I want dancers to just try and zoom out and keep in mind the bigger picture if you are dealing with an injury at a summer intensive, because oftentimes it's not worth pushing yourself so much during that summer intensive that potentially you make that injury worse, and then you actually lose out on time during the main part of your season in terms of not being able to participate fully if that injury hasn't fully recovered, if you've made it worse pushing through it. So sometimes I think it's so easy to get, kind of wrapped up in the current moment and thinking that the here and now and the summer intensive that you're participating in is the be all and end all. But in the great big scheme of things, it is usually an extra opportunity. And mostly what dancers actually want is to be able to participate fully during the main part of your season. So just something to keep in mind when you are thinking about whether you have to modify what's going on in class or things like that. It's far better to maybe have to modify or limit things for a really short amount of time if that means you can be fully fit and fully ready to dance in the main part of your season. So just something I will leave you with, a little bit of food for thought, and I will wrap things up there for today. I don't know if you can hear, there's a million sirens going by right now. Sorry about that. Anyway, I'm going to wrap things up anyway. So thank you so much for listening. I'm so grateful for your support, and I hope you have a great rest of your day.